In a way, this is a field where you are not in the front many of the times, right? It's another surgeon who takes the credit for the entire thing.
Anesthetist is behind a mask. Nobody knows. Patient comes, sleeps, tomorrow gets up and goes off. Will never be recognized. I have a feeling that James Cameron must have undergone this anesthesia.
Okay.
Only then he would have made Avatar.
30 years of being in this field. What excites you?
When somebody fails and they call me, I just love it. It's a challenge. The patient was playing guitar and the surgery was done.
Yeah.
Come on, if the patient is playing, you think you will be playing guitar. We have seen some old pictures where patient is being held by 4 or 5 people, made to drink plenty of wine, then amputation or any other surgery. From those crude days to highly sophisticated, in spite of all these air crashes, the air travel is still very safe, isn't it? It's the same way.
When we read in the news, it's mostly a lot of pediatric cases.
Like I told you earlier, pediatric cases, how will they go out?
Yeah.
And I myself, many times I was about to hit the tent when they give local. I was about to hit, I had to be restrained. How will a child use a term like it is a marriage in surgeon and anesthesia? It's not compliant. My wife can leave without me, and I can leave without her. But wife and surgeon and anesthesia, that's why your wife might just cook, whether you like it or not. She may not, give a damn about it. Whereas here it is not that.
Welcome to another episode. Today we're going to look at anesthesia. What is it? And to understand the impact of that on our body and how important role it plays during surgeries. To do that, we've got Dr. M.R. Chandrasekhar with us, a senior cardiac anesthesiologist. Welcome, doctor.
Thank you.
And as usual, I've got Dr. Prashant with me to dissect and understand some of the medical terms which I may not be able to understand. Welcome, Prashant.
Thank you.
So, sir, just to start off talking about anesthesia, if you could just tell us, in a very basic sense, what is anesthesia and how is it so important during a surgery?
Anesthesia basically consists of three things: relieving of pain, making the patient unconscious, and during the surgery, patient should not become aware of whatever is happening. The triad: analgesia, amnesia, anesthesia. 3 A's. Analgesia is painkiller. Amnesia is not to remember anything whatever is happening during the surgery. Last one is making him unconscious. That is anesthesia.
So, for us, when we look at it as a common person, we feel it's just one medicine. So, is it a combination of medicines that actually leads to it?
In fact, this is one common question every friends of mine who are, used to be with me during high school and college would ask, why would one do 3 years of master's degree in anesthesia to give a simple injection? Wish it was so damn simple. If you go into any medical college and go into anesthesia, department of anesthesia and their library, you will see nothing less than million books. Anesthesia is not about just one book. It's about multiple drugs. And going further, anesthesia, to give anesthesia, it requires a lot more than just anesthesia knowledge. I'm not putting down any other specialty people. Coming to ENT, he needs to know about nose, throat, and ear. A physician has to know about fever, heart, lungs. When it comes to an anesthetist, he needs to know every part of it in detail. If not more than a surgeon, at least he should know in detail about everything because he's going to deal with all these organs and his drugs are going to affect all these organs.
So, sir, just to understand it, obviously the impact is on all the body parts, right? But when we talk about that as a general anesthesia that a person is given, patient is given, but when we talk about anesthesia itself, there are different types of anesthesia that impact the patient. And how do you judge what is required? Is that judgment based on the type of surgery or based on the patient?
First and foremost is the surgery. What kind of surgery? Every kind of surgery requires different kinds of anesthesia. Neurosurgery, cardiac surgery, these things, most of the time, they require full-fledged general anesthesia. Otherwise, also now the present generation surgeries like laparoscopic surgeries, ENT surgeries, which have been made little bit more complex, and they require precise anesthesia, and the outcome should be very good. So that is the first indication. The second one is there anything which can be done with simpler form of anesthesia? That is either giving regional, that is only a particular part which is going to be operated. Make that area numb. Give anesthesia only there. That is the one. Then the third part is local anesthesia. Is it's a small surgery. Patient walks in and walks out after the surgery. So you make only that area numb. Then the relative indications come. Like a patient requires, demands that he doesn't want to undergo, come what may, unconscious. He wants to remain conscious. So if that surgery can be done without giving general anesthesia, we can do that. And there are certain conditions a patient has got, which are absolute contraindications for certain kind of anesthesia. You want to give a spinal anesthesia that involves giving an injection in the back. If there is infection, if he is sensitive to certain drugs, what I'm going to use, that becomes again absolute contraindication. So, uh, this is the way we select what kind of anesthesia to be given. But the latest one, the present trend is also the need of the patient. He wants to go back to work as soon as possible. He's a lone earner, and nowadays not many people give too many leaves. They can't take leave. So daycare procedure and make sure that he comes out of anesthesia as soon as possible, mobilized fast, and he discharged. Now, nuclear families, there's only one person taking care of the kid for that matter. So he or she needs to go back as soon as possible to work. But there are multiple factors also play a role. So as an anesthetist, my primary intention is to take care of the safety of the patient first, then comes the comfort of the patient, then comes all other factors which will make the surgeon and the patient feel happy with me. The bottom line is also this: they should be happy with me.
Yes.
They should come back to me.
No, but sir, just to understand, like a patient's point of view, right? Is it the anesthesiologist who is taking that call, or is it the combination of doctors, depending on what surgery is going to happen? I understand that the patient's condition will obviously be the main thing that you look at. How do you decide?
Now, to start with, that's why I said, who exactly is an anesthesiologist? Why does he spend 3 years doing masters and also works in another other hospital, big hospitals, where thousands of cases being done for another 3 or 5 years, learning all this. So, as an anesthetist, it is me who take the call. What anesthesia to be given? You have a good friend like Prashant. Once in a while, he can ask,
Suggest.
suggest, suggest. Nobody should demand.
Got
Nobody should command. Because you are the boss of your.
And like you said,
Subject.
sir, I think when the patient also does something or asks, it's a request. But the ultimate call will be with you.
Yeah, because I'm
because
doing
it's
it.
a life at stake.
Yeah, at the end of the day, I'm doing it for the benefit of patient. Patient might ask 101 thing. No, at the end of the day, it is his life which is in my hand. So I should have to make sure that he is safe and sound.
Yeah.
I can't be dancing for his whims and fancies.
So just talking about the patient, have you seen some of these patients? Because I've heard a lot that people dream when they're under anesthesia. They come back. Generally, they're not supposed to have any conscious, right? Not remember a lot of things. Have you seen any of these peculiar cases?
There are certain drugs which dissociate them. The higher levels get dissociated from the lower levels. There are very few drugs. So that is when, if you use those drugs, they hallucinate and they see If you ask me exactly, um, I have a feeling that James Cameron must have undergone this anesthesia.
Okay.
Only then he would have made Avatar.
Okay.
So they come out with very nice dreams and fantastic colors, out of the world experience.
Yeah.
They just say, Doctor, is there any way you can extend it for some more time? At the same time, there are certain people with the same anesthesia drugs, they behave extremely violent.
Okay.
Like I told you, the higher levels become totally free.
Okay.
That is when their true colors come.
So it totally depends on the patient then, not the drug.
I wouldn't say 100%, but that is what is my experience.
Okay. Have you seen any strange cases like this? When they came back, they had a very amazing experience or bad experience. Any patients that come to
The
the top
bad
of your mind?
experience is extremely rare. Bad experience is very, very rare. In fact, I have not come across, I've heard some of my colleagues say it, but otherwise, it's always been very pleasant. They
Okay.
like it. They like it. It's only when they become violent, we want no.
Yeah.
He want no. It becomes more tougher for us.
Because generally, what happens is when they go under, they don't remember what happens, right, during the entire procedure. So, if it's a general anesthesia, how does it happen? How do you think it happens? Because you would have seen so many patients.
Like I told you, anesthesia consists of three parts. One of that is amnesia. So they are not supposed to remember anything, what
Yeah.
is happening around. If they remember, you should take back my degree. That means I have not delivered the goods properly.
Those dreams that we are talking about, how does that happen then?
That I've told you very clearly. It is because of the dissociation between the higher centers from the lower centers. And also, many things what they have been suppressing in their life, they become free.
Ah.
I've seen between us colleagues, one of our colleague comes on a table and I give this kind of anesthesia, whether he comes for an angiogram, angioplasty. That is where I use this kind of sedation. And he comes out very, very clearly about what exactly he feels with surgery. All these days he's been suppressing that. And after this anesthesia, he will tell. Some of them might be pleasant, some of them might not be pleasant. Pleasant things he would have told anyway when
Yeah.
we are working. Unpleasant things will come out. So the
So
job
that's
of the,
like the truth serum.
the job of the anesthetist is whenever he sees something like this is happening, take him deeper.
That's
Cut
what
that out.
I was going to ask you, because the truth serum is something I've read about also, saying that you would have gone through those experiences and it actually acts like a truth serum.
So
many times.
ethically, as a doctor, we are bound to ensure that the patient confidentiality is maintained. So that's why he was telling the moment someone starts talking, they'll automatically take them into a deeper plane.
Mhm.
So that way we are ensuring that the patient confidentiality is maintained. And when someone is talking, it's a disturbance for the surgeon also.
Yeah.
So that's why they immediately induce it to a deeper plane, and then it will be comfortable. So there won't be any talking.
But just talking about talking, right? In some movies, they show that if it's a brain surgery, the patient is expected to keep talking. Is it true? Is that does that happen?
Yes, it is true because as such, brain doesn't have a, though it is a nerve, it doesn't have a nerve supply.
Okay.
So only the outer part when you cut and get into the brain, it's painful. For that, you give local anesthesia.
Okay.
Otherwise, when you're operating per se on the brain, the neurosurgeries, where the brain tumor or anything else is very superficial.
Yeah.
Or the newer machines have come which can go very precisely, even if it is deep inside, with very fine needles.
Yeah.
They are painless. So it is not a big deal like it is made in every other day in the paper. The patient was playing guitar and the surgery was done.
Yeah.
Come on, if the patient has pain, you think you will be playing guitar. There should be some limit for all
No,
this.
that is what. See, for us, the imagination comes from movies.
No.
And in the movies, they're
No,
asked to sing.
forget about movies. Movies, let them do whatever they feel. They are there to entertain. They are not here to educate you.
Yes.
But papers,
Oh, even papers.
Papers every other day. He was playing guitar and this great neurosurgeon operated. And people get carried away, and some critical case they want to stay awake during the surgery, and they move, and that's it. If the
Yes.
patient moves, another critical point is gone during the surgery.
Yes.
So every surgery is different. So the job of the media is to tell exactly what is it. Even let me not go to the next
So
question.
talking about that particular thing of someone playing a guitar, so since the brain is being operated, we never know what is going where, which nerve is going where. So when they're operating, they need to know that the functionality of the patient is there. So that's why they ensure they ask them specifically to play a certain instrument or do something in order to assess if they're touching some nerve which might cause some permanent damage.
Okay.
In order to prevent that, they are doing that. But in general cases, if patients ask me, doctor, I want to be fully awake when I'm operating, I tell, kindly find some other surgeon. I can't do it because it's very difficult for when, as sir told, that when someone is moving,
Yeah.
operating, especially because I go very close to the brain. So going very close and then someone just a small jerk, one, I'll have to go into the brain and again keep repairing the coverings of the brain. So that's why it's painful. So ensuring that they're fully sedated and they're paralyzed when operation is happening is very essential for most of the surgeons.
Okay. But when you look at
Oh, 1 second. Like what exactly Prashant said was, there is a reason behind why a particular surgery, a neurosurgery, where the patient is kept awake. So that surgeon should know he's not touching the right part of it. I mean, the non-diseased part of brain.
Yeah.
If it touches it, patient will not be
Able
awake.
to
He
play.
won't be able to play. He will have some paralysis or something which he can recognize very soon and don't go towards that. But this part of the story is never highlighted in any of the papers. They say he was playing. It was a cakewalk.
Very easy surgery.
It was a cakewalk, and everybody thinks, "Oh, it was great." Now, that is not the part. Like what Dr. Prashant told, that is the reason why certain surgeries, deep brain stimulation, something of this kind is done when the patient is awake, so that they don't make any mistakes and there is no damage to normal brain tissue.
So, doctor, is it good or is it recommended to go for general anesthesia in most of the cases, trying to reduce impact, or is there some impact or a long-term impact of general anesthesia?
In the last, this 1960, yeah, in the last 150 years, if at all, you might feel bad, if at all, if there's any advance, any boon to the humanity, it is this anesthesia. Anesthesia is the one which has made the patient very comfortable. Otherwise, if you have seen some old pictures where patient is being held by 4 or 5 people, made to drink plenty of wine, then amputation or any of the surgeries were done. From those crude days to now, highly sophisticated, excellent drugs, these things have come. And it's because of this, these people have advanced so much. They can go into any part of the brain which was inaccessible earlier when the patient was moving, when the patient was crying with pain. Now we are giving them best field, surgical field, and a cool, calm patient so that he can concentrate on what exactly he should be doing than worrying about the patient.
So, it definitely makes it easier for the surgeon to go deep and find the problem and resolve. So, it's a very good advanced technology now.
Not easier, it is a must. Without anesthesia, he would do
So
nothing.
if I put it from the surgeon's perspective, without a good anesthetist, surgery is not possible.
Okay.
Because anesthesia is so critical, especially for the surgeries which I perform. When I'm operating, I want the pulse rate to be low. I want the BP to be low. And the reason why I need this is because I'll be doing a keyhole surgery. So I won't be cutting up anything. So I'll be going inside the nose and I'll be operating. So without a proper anesthetist who can control all these things, it's practically impossible to operate.
So, when we talk about BP and pulse rate control, how important is the role over here of doctor?
So, as a surgeon, the pulse rate and BP is extremely important when we are doing especially keyhole surgeries or natural orifice surgeries. So, wherein when we use an endoscope and we are going inside the nose, I can talk about the nose because I'm just an endoscopic surgeon. So, that will impact the mucosal bleeding or the surface bleeding which will occur inside the intraop is very very essential for the anesthetist to control the bleeding. So the bleeding is controlled by control of the blood pressure, because if the blood pressure is extremely high, the bleeding will be more. And also if the pulse rate is extremely high, the surface bleeding will be more. So both of them have to be under control, and which is very essential, which can be done by the anesthetist, good skilled anesthetist.
Okay, now I'll just post a same question to both of you, looking at an ENT surgeon point of view and your point of view, sir. So, when we look at ENT surgeries, what are the surgeries that you feel general anesthesia is a must, and what are the surgeries where you think that local anesthesia or a regional anesthesia is good? Same question to both of you.
He is little young. I'm little old. Most of the surgeries earlier, whatever surgeries he is doing, uh, generally same: septoplasty, cabinectomy, and ear surgeries. Some of these surgeries used to be done under local also earlier, those days. But now, and it used to be open instruments, see what's happening in the naked eye, and do the surgeries. If they didn't get an anesthetist, or the patient was too scared of anesthesia, they would do it under local. I'm not sure what could used to be the results. But now, the present surgeries, which are most keyhole and scopy surgeries, have a big screen, they have a small scope going into the fiber optic, or rigid scope going into the nose, and operating, seeing on a big screen. The hole they make, the incision they make is very small. For this general anesthesia, the outcome will be very good. Since they're using a camera, small camera, even if there's a few drops of extra blood, blood will always be there. If somebody says bloodless surgery, please don't believe it. Doesn't happen. So even if there are a few extra drops of blood, comes in the way of this surgery. And once surgery starts going wrong, most of the times it doesn't end up well. So the role of anesthetist in controlling patients' BP, heart rate, and giving exactly the field what the surgeon is expected out of us is very, very crucial. The very fact that Prashant Reddy is sticking to me for so long should tell you, likes me.
That is given.
No, but just wanted to put it as a debate to understand from your point of view what surgeries you think. You've mentioned a couple already. Definitely require general anesthesia, because I think as an ENT surgeon he would recommend more surgeries to be done with general anesthesia. But as an expert in that field, do you think there are some which many surgeons might be doing under general that you think regional or local would still suffice?
In this time and era, if you ask me, if there is something so comfortable, safe, enjoyable, do it. Do it under them. Otherwise, if you ask me, septoplasties and tonsillectomies, adenoids have been done under local adults, not pediatric cases. Pediatric, whatever it is, don't do it under local. Maybe will not cooperate. Even if you hold the child hand, leg, and all, it will be a trauma for the child for its life. Don't do it. Don't do it. But for adults, earlier there used to be this myth about anesthesia. Maybe they used to be scared, maybe they couldn't afford, they would do it under regional. And maybe it was not safe. Certain drugs would act for a long time. Sometimes people with comorbidities would not come out of anesthesia. They would take longer time. They would do it under local. But now, if you ask me, there are no surgeries which should be done under local. Even when you are doing it under local, it involves giving multiple injections. Who would want to be awake taking multiple injections, isn't it? Even when somebody is doing it under local, nowadays, the surgeon insists that I give sedation before the local anesthesia is given. So the era of doing it under local, unless it is a very small, just below the skin surgeries, nobody would advise undergoing surgeries under local. I would definitely recommend.
So then it's a very good marriage done then, right? So the surgeons are also happy because I think it makes your job so much more easier. Like Sir said, the field is left to you.
Yes.
It becomes so much more easier. You have more visibility. There's no shake, jitters, unnecessary movements. So it makes it easier for you.
Yes. So one surgery which I think Sir also agrees would be an emergency tracheostomy. Emergency tracheostomy would be done in case there's obstruction above, so they can't put a tube in. So that's when we do it under local anesthesia. Other than that, all the surgeries which I do will be under general anesthesia. Yes, as Sir was telling, when I was a PG, I myself have done surgeries which were under local anesthesia, and that time patients were moving helter skelter. It was, and I vividly remember one patient coming back and telling one of my professors that ಏನ್ ಸರ್ ಮಾಡಿದೀರಾ ರೋಡ್ ರೋಲ್ ಬಿಟ್ಬಿಟ್ರಿ ಮೂಗಲ್ಲಿ. So translate to English, what have you done, sir? You have left a road roller in my nose when you were operating. What were you doing? So that's the trauma which the patients will carry, which is why I prefer all my patients to be under general anesthesia come what may.
You're talking about the
One
trauma.
second, you use a term like it is a marriage between surgeon and anesthetist. It's not compared. My wife can live without me, and I can live without her. But wife, surgeon and anesthetist, no.
So it's more symbiotic than that relationship.
Yes.
Definitely.
No, talking about symbiotic relations, right? How do you both share, airway, right? It's one small space. You both are there trying to ensure the patient's life is active, everything is fine, and you're trying to operate in that space. How does that happen?
That's why the jugalbandi is required, because we share a common airway, and that's why most when you ask any anesthetist which is the most dreaded surgeries that you have ever encountered, I think everyone will agree that it's ENT surgeries, because because we have the shared airway, especially for your tonsils and for your nose. Any bleeding which can occur after the surgery is quite risky. That's why we need a very, very good trained anesthetist to ensure everything is proper post the surgery, provided the surgeon has taken care of all the bleeding points before handing it over to the extubation. So that is very, very crucial. But then too, there are cases wherein there have been instances because of a small trickle, the blood clot would have gone into the lungs and would have cough or spasms and stuff like that. But that can be managed with modern drugs and modern techniques.
So it's constant, right? Both of you are monitoring the patient and
Let me put it from my side, from the beginning of your question. If you if you read any textbooks or if you ask any surgeon, cardiac surgeon will say mine is the toughest. Neurosurgeon says you have nothing, half heart. Neurosurgeon will say even a small part of brain is gone, guy cannot survive. But for an anesthetist point of view, those two are most of the time it is a long surgery where the evaluation of the patient is complete. And if I wouldn't be saying it, but if things go wrong, patients take it okay. Like heart surgery, yes, things gone wrong. It's okay. Brain surgery, oh, he bled from some other part. The acceptance is already there before the patient comes. And generally they are old.
Yeah.
Isn't it? Whereas ENT patients, most of them are young. And forget about me telling Prashant saying about how critical the ENTs are. You have the statistics. You have newspapers, no? Every other day, child after tonsillectomy, this man after no surgery. Most of the time it is ENT surgeries who are got into trouble because we share the airway. This small place where surgeon operates, and I also have to take care of it, take care of the air. But why I like certain surgeons is most of the surgeons, if somebody feels bad, it's okay. Most of the surgeons stick to their surgical point only. There are very few who are kind of complete doctors. Most of the guys don't give much importance to their MBBS because they always know I'm going to do my best. But very few who have given a lot of importance to their basic education. That's MBBS. And also they do their post graduation. Somebody like that, example him, he knows my requirements also. When he's operating in that area, after I inserted a tube into the lungs, he knows that he's impinging on my tube. He knows that he's coming in my way of delivering my goods. He will know. So he will, and certain drugs he will inject to make from his side, the bleeding should be very minimum. Whatever I can do, I do. From his side, whenever he is injecting certain drugs to make the bleeding less, he will warn me. He will just not, go on doing his job.
Yeah.
And say, at the end of the day, anesthetist didn't do.
Yeah.
That's why. That's why your wife might just cook, whether you like it or not. She may not, give a damn about it. Whereas here it is not that.
Yeah.
He has to make sure what is he doing, he should tell me. And I have to make sure whatever he wants, I do it. When a critical point comes, I should know, okay, his BP should be little lower than this. Heart rate should be little lower than this. Every step I should know.
Yeah.
That is what I told you. It is not just about anesthesia, my knowledge. I need to know every step of what it is. And if I am lucky, I get few surgeons like this who understand my difficulties also and gels with me.
That was going to be my next question. That who takes a call, especially when it's the windpipe, right? It's one small space. Who will take a call? ENT surgeon who's operating at that moment, or you both have to understand what is needed at that particular situation.
Again and again, you are the one who started wife and husband. At home, it's wife who takes call. Outside, it is me who take call. But in ours, both of us together. It is always when we are taking decisions together, all together, the patient outcome, surgical outcome, everything will be perfect. Not better.
Perfect.
Perfect.
And so talking about perfection, I'm just trying to understand from a patient or a common man point of view. When you give those injections, when you actually put a patient under, how do you ensure that they stay under for that particular duration? Is there something you're constantly monitoring? Because I would understand that it's a nerve signal, right? The brain. How do you monitor that, and what is it, or make it very simple for somebody?
Yeah. It is very simple. It's not so complicated. Basically, the monitoring system what we have is quite sophisticated and quite advanced, and it's made very, very safe. The surgery and anesthesia is made very safe. In this context, somebody was asking, in spite of all these air crashes, the air travel is still very safe, isn't it? It's the same way. Anesthesia, everybody dreads, but you don't see so many mishaps. So it is made very safe. The monitoring system is extremely good. So you have heart rate. Just think, if you are sleeping, most of you have got those smart watches which tells you heart rate 60, 70 throughout the night. The minute you got up, it shot to 80. When you started walking, it went to 90, whatever it is. It is the heart rate. It tells first signal is that. So if he tries to coming out of anesthesia drugs, what I have given, the initial drugs, the heart rate. Once the heart rate comes up, BP also starts going up. These two are pretty, earliest methods. Now, There's one more thing called as end-tidal carbon dioxide. So it shows the carbon dioxide output from both the lungs. It'll be extremely uniform from both lungs. If the patient is coming out of anesthesia or the relaxant whatever given, there'll be fluctuation because one lung deflates bit early, other one deflates bit late. But that gives us one idea that patient is coming out. These three are the basic monitors which should tell me about the depth of anesthesia. How deep is anesthesia? Is he coming out? These three things will tell me about what is intravenously through the vein, what is going. There is something else called brain monitoring also happens in certain cases. So it's called BIS, BIS. That tells me if the brain activity has started. Okay. So accordingly, we take the patient a little deeper. Okay. Apart from all these IV drugs, what we're giving, which needs to be repeated at certain intervals, like I told you, the primary goal of an anesthetist, patient should never become aware in between the surgery. Yeah. It is the worst thing one can experience. This guy is hitting the nose, doing this, doing that. I mean, it's very cruel.
Yeah, he was talking about that road roller going in the nose.
That is past.
Yeah.
No.
With the local anesthesia. Yeah. So that's the reason.
Yeah. So such thing, patient, is awake. He knows something is happening, but he's not able to tell anyone because there's a tube down his throat and he's paralyzed, isn't it? Yeah. So that's why there is something called as inhalational anesthesia, which is going continuously along with the oxygen and air or nitrous, whatever gases you use to keep the patient awake, alive. Nitrous and these inhalational drugs like sevoflurane, isoflurane, desflurane, they keep going. They keep the patient unaware. So even if he comes out, it is the heart which comes out, or the muscles which start twitching or coming back to work. But the brain is numbed by these drugs. So all these things which we can know from reading the monitor.
And so you will know when they're coming out, you can increase the dosage, you can make those changes, and you can prolong it. Yes. And is it the reverse when you're trying to wake them up?
Exactly.
Okay.
Exactly. I cut everything.
Okay. So
except oxygen. I keep oxygen because I like them. I want them to get up.
So when you say oxygen, so you're controlling what air is going or which particular molecule is going into their lungs?
Everything.
Okay. So when we talk about oxygen, that is another question which I have to go through. When you say oxygen which is supplied, is it pure oxygen in the OT?
The medical grade oxygen.
Okay.
And other treated oxygen, do they use anywhere?
So it's not the air that we normally breathe, it's just pure oxygen, because supposedly that's very good, right, for the brain. And
I don't know, unless you give the oxygen contract to some Jharkhand people or someone,
no, because in
ghee itself to Tirupati Laddu, they could adulterate oxygen also.
Because, sir, in Japan, I heard there are bars where people can go and breathe pure oxygen.
There are bars in Bangalore also.
No, it is.
That is different.
What exactly they mean, pure oxygen is
that is
100% oxygen.
Yeah.
100% oxygen. That's all.
Okay. So during the surgery, it's 100% oxygen. Which
no.
It's a mix only.
Oxygen is one. Okay. Other things like nitrous are mixed up with air. 100% oxygen is rarely given because
that was my question. Sorry, I didn't use the right term.
100% oxygen for a longer time.
Okay. So that is what I wanted to understand, because what I understood was when you breathe in pure oxygen for some time, it definitely benefits your brain, enhances, and so many other things. So somebody who goes through surgery, I thought they'll come up with a much better brain. So it's not that generally.
Yeah, it can happen. You take anesthesia.
Or get operated by post-op.
Yeah, that happens. That happens with a surgery. The fogginess,
Yeah.
people who come with sleep apnea syndrome, you know, there are people who they sleep while driving. That means they have not slept properly,
Yes.
and they get up groggy in the morning. They are not fresh at all. If they undergo correction in the nose and sleep apnea surgeries in the throat, they can breathe better, and within no time, their brains are cleared, their working capacity has increased. Overall, there's very good development.
I can vouch for it, sir, because I was
Have you
a Sludder's
undergone
neuralgia patient, right?
Oh,
So I
right.
had that prick in the nerve, and it used to trigger migraines, and that completely disappeared. I mean, it doesn't make sense when I think about it normally. I have gone to somebody who takes care of stomach, brain, everything, all different surgeons or doctors,
only
and
had taken
finally,
him.
yeah, finally he himself had to do that surgery to relieve me of that, because I was blaming drinking, I was blaming not eating on time, and so many other things. Now I'm completely fine, and I just realized it's breathing and that nerve which was getting pressed.
So now I understand why your questions are pretty sensible. You're a patient yourself.
Patient myself, and we are trying to do some homework also.
Okay.
Because otherwise, asking doctors questions is a very, very difficult thing. Because
That I know.
for us, it generally feels like it's very easy. But what I've realized with the work I was doing with Dr. Prashant is that it becomes very difficult, especially to understand some context. I think that is more difficult rather than the medical terms. Medical terms, we have Google and other things. Understanding context becomes easier when I speak to more surgeons or doctors like you. So when we talk about local anesthesia, just bringing back to local anesthesia, do you see more, or I see that it's mostly used in dental cases nowadays more than others. But even there are instances when something extreme happens, right? Why does that happen? Because it's a local anesthesia. How does that impact the body?
Um, Local anesthesia and extreme. It's a very, very rare thing. Reaction to local anesthesia is 1 in 2 lakh.
Okay.
Buy the books. 1 in 2 lakh. It's a very, very rare thing to happen. What dental over things, I mean, mishaps you have heard about is when they're given anesthesia.
Okay, general anesthesia.
General anesthesia or deep sedation when they're given dental cases. That is where the mishaps are happening. Because you try to treat it as a minor procedure.
Yeah.
Dental extractions or cleaning or any of it is. And you try to not to take too many precautions, try to do it in the dental department itself, which is not all that well equipped with anesthesia machine and monitoring and all that. I think it's a short procedure and give anesthesia, but they do require deeper planes of anesthesia. Have you undergone one?
No, no. Thankfully, not yet.
Lucky you are. Once you undergone, you will know. Wish you had undergone this procedure in the theater under proper anesthesia.
Mhm.
So they kind of take a lenient view towards these things.
Mhm.
And once the tooth extraction is over, because there is no proper monitoring, there is no proper recovery room, they have left the patient and anesthetist has moved back to theater. That is when the problems are happening. Because the staff there are not trained
Yeah,
to take care of a patient after anesthesia, isn't it?
correct. No, that was another thing that I thought might be the reason is because when we read in the newspapers, see, for me, those sources are newspapers.
Yeah.
So when we read about them, it's mostly a lot of, pediatric cases where,
Like I
it
told
goes
you
on.
earlier, pediatric cases, how will they cooperate?
Yeah.
And I myself, many times I was about to hit the dentist when they give local. I was about to hit. I had to be restrained. How will a child will allow anyone to touch their mouth and pull their teeth or anything of it? They do give anesthesia. But it's just that, like I told you, the 99% of the time, it is just that the dentist says it's just 2 minutes procedure. You can't take it to theater, financial restraints. Take it to theater, it will be too expensive. Just give some mild sedation here.
Mhm.
That is
So,
where things happen.
and that's where experience also comes in. I think a dentist who's very tenured, they know how to deal with a particular patient. and all
No,
that.
again, the problem is I know Dr. Prashant very well. Every other day we meet, or every day we meet. Dentist, how many times?
Mm.
Even when I have a serious toothache, if I can avoid the department, I would love to avoid it. How many times does he call me for
Yeah.
these procedures? It's very rare. I don't know his capabilities.
Mhm.
I don't know how good he is.
Yeah.
I don't know. He might say 2 minutes. He might take 20 minutes.
Mhm.
I'm prepared only for 2 minutes. I don't know the surgeon well.
So
For
those
an,
things
for
lead
an
to.
anesthetist to know his surgeon is extremely important.
Mhm. So when we talk about those pediatric cases, they are generally under general anesthesia, and where they've not monitored well, that's when the risk is higher. Okay. But just talking about general anesthesia, again bringing us to a lighter note, why do patients wake up laughing? There are a lot of instances when patients wake up laughing.
That's what I told you when we give certain drugs which dissociate them from the higher levels. Oh, it's not exactly laughing, it's delirium, it is called.
Okay. So
Or
you'll have to define that to us.
What do you, how do you know?
So it's
Otherwise,
like
they would have been laughing at the surgeon. Stupid job. No, they don't get up laughing.
so delirious would be like when you put it in a common man's term, a totally drunk state.
Okay.
So they'll be like in a totally drunk state, and then when they wake up, because they will be totally disoriented.
Mm.
So that disorientation is because when they wake up from an anesthesia, it's like the meme which I was seeing in the morning, like the three penguins of Madagascar. The guy with waking up, wake up, wake up, wake up, and then slowly the eyes open up. That's when the anesthetist and the surgeon will be happy.
Present there.
Happy.
Okay.
So that's when they'll wake up, then they'll see suddenly full bright lights.
Yeah.
So that will again lead to confusion. So it's kind of a disorientation which they wake up.
Disorientation, generally disorientation.
So, and most of the time, like when I went under, I remember just counting down. It just took, I think, one or two numbers, and I was out. Right. But I've heard that there are some people who can go up to 5 or 6. Have you seen any cases where those numbers are very, very high? Like they're able to count down to a bigger number before going out.
First and foremost, I don't make anyone count numbers.
Okay.
I know what exact drug I'm giving. I know what this patient's habits are, what this patient's investigations have suggested me. How much, what's his weight, how much dose I should be giving, and how fast he is going to fall asleep. All that I know. So all I tell them is to think of something nice. They will definitely have some pleasant dreams. Anesthesia drugs, given at the right dose, at the right speed, should make a patient unconscious in one arm brain circulation.
Okay.
Arm, brain, from here to here. That's it. They should be unconscious. They should not be
Okay.
counting 20, 30.
And talking about counting, I've seen this. I don't know if it's an IV because I've seen just videos through IV, or is it through
No, it's
oxygen?
those days it used to be from mass or where you don't get an IV for a pediatric case
Mhm.
child. They will not allow to touch.
Mhm.
And even if the baby allows, the mother will not allow. Isn't it? So sometimes I feel you should give anesthesia first to mother, put her to sleep in recovery, and take the child inside. So for the child, we give it through the mask.
Okay.
When the child becomes little, sleepy, immediately secure an IV line.
Okay.
Then give it through the drugs to make the patient maybe unconscious.
Okay.
Otherwise, when these IV drugs were not there, that was even before me,
Mhm.
they would do it only with the mask.
Mhm.
When ether was there, they used to put ether from top
Okay.
and it would vaporize very fast and put the patient to sleep.
Oh, okay.
That's even in the museum it is not.
No, what about that?
Bush mask it used to call.
Is it a regional anesthesia when a patient has been made to bend and then the nerves,
Spinal
spine.
anesthesia. Spinal.
So is it something which is just regional or that is also general? That's regional.
Anything that is regional below the umbilicus. If you
Okay.
want little higher also, adjust the space where exactly you're giving the injection or the position of the patient once the drug is injected, head low, head up. So we can adjust the level of anesthesia, but not above the sternum.
But sir, isn't
So
it better?
on this topic, a lot of my patients come and ask me, Doctor, do I get spinal anesthesia for the nose surgery? I'm like, how is your spine related to your nose? They have seen their wives or their mothers
Yeah.
undergoing the
Cesarean
section.
hysterectomies.
So that's when they'll be like, Doctor, are you going to give anesthesia here? Is it going to be painful? My back, will I be able to walk? I'm like, no, no, no. We'll give you mask, we'll give you injection, and we'll make you sleep. This is a common anecdote which I just recalled now.
No, that's what even I was just wondering that in those cases, why is it particularly given there? What are those cases? Because I just want to know, can they be given general anesthesia?
Yes, general anesthesia can be given to anyone, except for few. There's very few contraindications to give general anesthesia.
Okay.
This is done with the idea of safety. Whatever can be done without using multiple drugs. General anesthesia involves giving multiple drugs, taking control over his lungs, taking control over his breathing. Whereas this involves a simple injection in the back.
Okay.
And this backache, all that is a myth.
Yeah.
If one is going to give backache, a permanent pain to a patient, our oath should be it's not right. We don't do it.
Is it more that trauma of just being in a room, maybe under the AC, and then when you're bent down, that probably sits, it's more psychosomatic than the actual pain? Could be that.
So many of these procedures, bottom line is risk benefit ratio.
Mhm.
What is the risk of giving this anesthesia over that anesthesia? The risk benefit ratio suggests give regional anesthesia or a back procedure. Most of the time is for cesarean sections.
Mhm.
Multiple drugs you give, some of it might go into the baby.
Yeah.
So this simple injection will not cross the placental barrier. It just makes the mother numb to the umbilicus. And mother is also very happy when you tell Gandmagu.
No, but then the mother will always blame the husband then, saying, you made me go through all that.
That's only in movies, you don't worry. Otherwise, mother is always very happy when she sees a happy child, happy, healthy child. Also, old people with multiple comorbidities, diabetes, hypertension, all such things. And instead of giving multiple drugs, give general anesthesia and already diseased liver, diseased kidney, which might process these drugs for a longer time, or it may hurt the liver or the lung or kidney. One simple injection in the back, take care of all that. So there are indications, contraindications, but as such, there is no absolute contraindication to give general anesthesia. One wants, unless the liver and kidneys are totally gone, you can give general anesthesia.
So, sir, after so many years of being in
30
this
years.
field, 30 years of being in this field, what excites you? You see a lot of these changes, or is it working with different surgeons who come with those, passion? Is it the patients? What drives you?
If you want a very honest answer for this, is like I said, I was trying to take example of Makala, where he sings a song, then he goes up to the room. He is appointed as a room boy with a party. So she's asking, "आप इतना अच्छा गा लेते हैं, ये क्या कर रहा है?" Amitabh says, "गाना गाने के साथ खाना भी खाना है." The bottom line is that's what drives me. You have a family, you have children, take care of them. Somebody said, passionate about now teaching. I love giving. How many years will you do it? For me, at least.
Yeah.
This is the driving point. Second thing is, I love anesthesia. I love giving anesthesia, especially good surgeons, complicated surgeries, end of the procedure. They just, it's not, money is the bottom line. There's no doubt about it. One good word from the surgeon was different. He's working with me for the first time. Or he has worked with somebody else and come to me. It was good, sir. Thank you so much. Surgery went off. Nothing like it. I'll tell you, just the other day, middle of the night, they call me for an intubation. In ICU, intubation, I don't say no because it saves the patient.
Yeah.
Though it's a very small procedure, many of the anesthetist point of view, saves a guy. Next day morning, in fact, next day evening, when I went, patient was fully awake, alert, he was dialyzed in the night. He was not able to lie down or even sit, so breathless he was. He was all right. They had extubated him by the time I went in the evening. Did the procedure, put the dialysis catheter, intubated him. Walking out, the housekeeping person who's 60 plus, he said, "Here, doctor, yesterday I was so happy, so happy. That kind of recognition.
Yeah.
That is one thing. Then to be crude and really mean, when somebody fails and they call me, I just love it. It's a challenge.
Yeah.
And this is one place where I don't decide how much I should be paid. That's thrill.
Yeah.
Somebody didn't do it. I'm called. And I'm going to do it and I've done it. Thank God. These are few things which will keep you continue doing the same thing.
Awesome. But it's very nice that you're being honest. Many people, like you said, they won't start with honesty, talk about passion and other things. But you brought in, there are definitely, I see passion. Because when you started answering my questions right at the start, I saw the passion there for the field itself. Because in a way, this is a field where you are not in the front many of the times. You're not standing in front of the patients many of the times, right? It's another surgeon who takes the credit for the entire thing. And you are at the back end equally important, playing a very, very critical role. Like you said, solving a lot of challenges, but it becomes very difficult for the patient to understand that.
It was not that as an undergraduate you will be exposed to anesthesia. So it was not my passion or love for anesthesia I chose anesthesia. I went for orthopedics. Then somebody who was outside a particular person's chamber asked me, "Want to do orthopedics?" Yeah. Where are you from? Bangalore. How many orthopedics? One. There are 600 orthopedic surgeons, but you know only one as a doctor. How many ordinary people will know any orthopedic? Oh, you want to do orthopedics. Good backup you have after your master's. You can't pick up your practice. I said, no, I need to start earning. Then do anesthesia. I thought he was being practical. I went and told my sister. She said, no, anesthetist is behind a mask. Nobody knows. Patient comes, sleeps, tomorrow gets up and goes off. You will never be recognized. I said, no, I want to do anesthesia. She put 2 chits, orthopedics and anesthesia, took it to a puja room and kept it there for some time. Then she gave it, pick up one, picked up anesthesia. Then I told her, give me some time. I'll come back and give you this chit. Kept the chit for a long time. I don't know whether it is right to reveal the person's name here. But anyway, what's there? I did give anesthesia to the king.
Oh, okay.
And many people told me, you're too young. Do it with another scene. But I knew I could do it. I said, no, I'll do it. That day, after the gentleman got charged, it was a mega surgery. I went back and gave the chip. Here, am I famous now? By then, she had heard from so many sources.
It was fate that picked it for you, along with it becoming your passion also. So can I say it was fate and passion?
Yeah, difference between most of the surgeons and anesthetists is once you join a course, you kind of within 2-3 months, if you show proper interest and if you study the theoretical background well, they let you do procedures. So it's kind of hands-on. You're studying in one hand and you're doing procedures.
Yeah.
It is not that you're all the time studying and mopping the floors or putting some IV and not doing practically involved with the patient. That is one different thing in anesthesia. Right from the word go, if you're honest, if you put your 100%, any senior in the department, any professor, any associate professor will recognize you. Will start giving you chances to handle a patient. It's always under their care, but they give you chances. So then it is nice. You're doing something. So it all became 2+2.
Really nice. Thank you so much, sir, for taking out time today and giving us that background and helping us understand how important role this is. It was really great, but there are so many more questions. Hopefully, we'll get to do a part 2 with you again.
Definitely. This pleasure. Maybe it all went off well because intelligent compared to many anesthetists.
Thank you. I'll take any compliment coming from a surgeon, a senior surgeon like you. So
Anesthetist.
Sorry. A senior doctor with so many years of experience. I'll take it as a compliment. Thank you so
Thank
much.
you.
Thank you for watching. Please do look out the space for more such interesting episodes.